Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my 40-year-old brother has been in intensive care for 4 weeks after a bowel obstruction and sepsis. He's still ventilated with tracheostomy and I don't want him to die. Help! You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is: my mum had 2 heart attacks within 6 months and she's now in intensive care. She's in an induced coma. What's next for her? This question from Basilica formed part of an email counseling and consulting session with me. So, Basilica writes: Hi Patrick, my mum had a heart attack 2 days ago. Unfortunately, she's unconscious, in an induced coma and on the ventilator with a breathing tube in intensive care. My question is it necessary to keep her asleep all the time? My mother is 75 years of age and had a previous heart attack in December last year. Any insights into this would be much appreciated. Thanks, from Basilica. So, here's my response. Hi Basilica, thank you for signing up for my email counseling and consulting. I really appreciate it. So, here's the answer to your question. If your mother had a heart attack last year in December and she's now suffering from a second heart attack, she's probably too sick to be awake and she needs ventilation and the induced coma to be kept alive. A second heart attack within 6 to 7 months can have devastating consequences to the life of your mum. Therefore, ventilation and the induced coma are, generally speaking, the right things to do. As long as she needs ventilation, she will need to be in an induced coma so that she can tolerate the ventilator and the tube in her mouth. Otherwise, she wouldn't be able to cope. It's very uncomfortable to have the breathing tube and the ventilator attached to your mum. Therefore, she needs to be kept asleep for now until she's more stable and can be woken up. On the other hand, your mum may be so sick and unstable that she may be asleep without too many medications on board anyway. You have to ask the doctors and the nurses whether they keep your mum asleep with medications or drugs, or whether she's asleep naturally because of her illness and because she's so weak because of her heart attack. Chances are that your mum is in an induced coma, but you'll only know and find out if you ask. Here's also a link to an article and video that will empower you to ask questions when you are in intensive care. So, if you check out 3 quick steps on how to position and prepare yourself well mentally whilst your loved one is critically ill in intensive care, check out this link below the video. There is also a very high chance that your mother's heart has decompensated after the second heart attack within less than 6 months. Therefore, your mother's heart muscle is most likely so weak that it'll be difficult for the weak heart to maintain a good blood pressure. There is a very high likelihood that your mother's heart is currently not strong enough to maintain other vital organ functions, such pumping enough oxygenated blood to other vital organs such as to the liver or to the kidneys. Therefore, the oxygenated blood that's coming from the lungs can't be circulated around the body and sufficiently perfuse the kidneys and the lungs. In order to ascertain how much damage there has been caused to the heart, the intensive care team as well as the cardiologists should have done the following tests and diagnostics. They should have done an angiogram to find out where the heart attack originated. For example, they should look for a blockage in any major coronary arteries supplying the heart with oxygenated blood. And this could have only been done if your mum wasn't too unstable. They should have also done ECGs to determine and interpret any damage done to the heart. An ECG basically is when they're attaching leads to the chest of your mother and then get a snapshot of the heart rhythm onto a monitor, and that can show the doctors and the nurses where the damage in the heart has been done. They should have also done ultrasounds of the heart as well as a transesophageal echocardiogram, again to determine the size of the damage as well as to determine the ejection fraction. Ejection fraction is an important measurement in determining how well your heart is pumping out blood and in diagnosing and tracking heart failure. Normal ejection fraction is between 50 to 75%. Anything below 50% may indicate heart failure. Your mum will most likely need time to recover, and she's also most likely on inotropes and inotropic support. Inotropes are intravenous drugs given for low blood pressure and a weak heart. Inotropes are also drugs that can only be given in an intensive care environment. They need constant monitoring and experienced intensive care staff to manage it. Therefore, stabilizing your mum is priority. Let her take a rest in the induced coma and give her heart as well as her body recover and heal. Your mum will also be at risk of going into pulmonary edema, which basically means she can accumulate water in the lungs after the heart attack, as the lungs may experience fluid congestion from the inability of the weak heart to pump blood and therefore fluids around. Therefore, all vital organs will need close monitoring and management until your mum is more stable. The same applies to the kidneys. As long as the heart is weak, there is a risk that the kidneys are not getting enough perfusion and kidney or renal failure may occur. Again, the kidneys will need close monitoring and management in order to sustain functionality. I'm also including 2 more links to articles and videos here for you so that you can find more information about heart attack in intensive care and induced coma in intensive care. So again, check those links out below this video in the written version of this blog. So I will explain in those videos and blogs how long your mum can stay in an induced coma. You should also check out another question from one of our readers in the past, where a lady asked, "My husband suffered a heart attack, has been in an induced coma for over 3 weeks now and is not waking up. What do I do? Help." Again, there is a link below this video in the written version of this blog to the question of the reader. You really got to be patient, Vasila. I know it's very worrying watching your mother suffer, but being in intensive care after a heart attack can take time, especially since it's been your mother's second heart attack within 6 months. It's often 2 steps forward and 1 step back. If all therapy and treatment fails and your mother's heart remains weak, there is a possibility that your mother might need cardiac surgery for bypass grafts. Again, you can find out more information about bypass grafts on our website when you check out intensive care conditions, and you find a link to cabbage or bypass grafts there, and you'll find all the information there. Bypass grafts, however, can only be done if your mum is more stable, or if an angiogram has been done determining the location and the severity of the blockage in the coronary arteries. A blockage in the coronary arteries basically means that if a blockage occurs, no oxygenated blood can supply the heart, and therefore a heart attack occurs. The ventilation, the mechanical ventilation and the induced coma that your mother is in at the moment isn't going to stop your mother from going to have cardiac surgery. On the other hand, if the damage to the heart is too significant and too severe, it may increase the risk for cardiac surgery and bypass grafts. Therefore, the intensive care team, as well as a cardiologist, may suggest conservative management for now. Another option may be to go on ECMO if the heart is really weak. However, the intensive care team and the cardiologist may think that at the age of 75, ECMO might not be appropriate, as the age cutoff for ECMO is usually around 65 to 70 years of age. And just for any of you who don't know what ECMO is basically an external bypass machine where the heart, where the function of the heart is basically replaced by a bypass machine, and that could be done, for a period of time, 2 weeks, maybe 3 weeks, depending on how stable your loved one is. And that could also lead, or could also buy time for a heart transplant. So the ECMO machine is really to give the heart a rest, let the heart recover, and also to buy time, maybe to go on to an LVAD, which is a left ventricular assist device, or an RVAD, a right ventricular assist device, and also to go on maybe to a heart transplant. So I really hope that helps, Vasilia. Please let me know if there's anything else I can help you with. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly, whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you'll learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find international phone numbers on our Contacts tab. Also check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the Products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.